Hello, everyone. It is so excited to be here today. Welcome to Seattle Pride's Facebook Live event focused on issues surrounding COVID-19 among Seattle's LGBTQI+ community, presented in partnership with the Washington State Department of Health. I'm Tracey Leong, KIRO 7 morning anchor, and I have the privilege of serving as today's moderator. So joining me today are Krystal Marx, Executive Director for Seattle Pride; Mattie Mooney, Senior Program Manager for Transgender Healthcare Navigation, Swedish Health Services. Hello. And Dr. Kevin Wang, Primary Care Physician at Swedish Family Medicine, First Hill. So exciting to have everyone here today. During our time, we'll be exploring a number of topics related to the pandemic, vaccination, and issues surrounding both within the LGBTQIA+ community. For those who are viewing live, if you have any questions at any time, please add them to the comment sections, and our panelists will compile their list of answers and share them on social media and on our blog at seattlepride.org. So let's go ahead and get started. Our first question is for Krystal. What do we specifically know about the LGBTQIA+ community in terms of pandemics? And how does that impact the public health response to COVID-19?
Well, I think that's a great question, Tracey, and thank you so much for being with us today. The LGBTQIA+ community is made up of so many different members of every community that we have. So we are at the intersection of every community that you can imagine. We have folks who are disabled in our community. We have BIPOC folks who are Black, Brown, and Indigenous, and people of color. So the LGBTQIA community, though, in particular, tends to find ourselves, we tend to find ourselves at the most marginalized areas of community. We are folks who may have experienced difficulties growing up, remaining in our families after we've come out. There could be higher issues of being in foster care or experiencing homelessness. So when you look at all the different things that can impact a community, not to mention what people tend to think of first, which is the AIDS pandemic or HIV or anything else. You look at all the different layers. We tend to find ourselves at greater risk for developing symptoms for things that are in a pandemic. So COVID-19 can hit very hard when you are already on the margins, you are working jobs where maybe you are at the forefront, like a frontline worker position, and are exposed to more people. Our community tends to find ourselves primarily in a lot of service jobs or office jobs where we're working next to folks, and not always with the resources to be able to work from home. So that greater risk and exposure is there. It impacts the public health response to COVID-19 in the way that we have to make sure that there is one that is specifically targeting the LGBTQIA+ community, just like we would specifically target other members of the population as well. We have to make sure that when we are doing outreach, when we are having vaccination clinics, so we are doing testing sites, they're at places where our community tends to congregate. If we don't do that, we're missing an opportunity to really meet people where they are and to provide that access they may not be able to have otherwise.
Krystal, thank you so much. Our next question is for Mattie. According to the Human Rights Campaign, only 42% of LGBTQIA+ adults say they're highly likely to get the vaccine, a number that's even less, 29%, among Black LGBTQIA+ adults. Why do you think that is?
I want to answer that. And before I do, is Kevin, I know that Kevin wanted to speak on the last question, if that's okay.
Thank you so much, Tracey, for giving me the space to chime in just a little bit. And, you know, everything Krystal just said is absolutely true. But when it comes to the public health response to coronavirus, I think one of the things which really impacted the LGBT+ community is sort of this sense of visible invisibility, right? So the LGBT+ community is certainly known. People know we're out there. However, when it comes to the vaccine trials, when it comes to testing, LGBT+ identity is not information gathered. And what ends up happening is the public health departments, they don't know where to allocate those resources, particularly when it comes to marginalized LGBTQI plus folks. So I think when it comes to our community and how the public health departments respond, because they don't have this information, we are an unseen community, and the resources which should be allocated to us, particularly our BIPOC community, particularly our communities with physical and mental diversity, of all socioeconomic statuses, these are resources which aren't being properly allocated because they don't ask us this information, and it's not being incorporated. This was also seen when you saw the vaccine trials. The initial trials did not specifically gather LGBTQI plus identity, and so it's really tough for us to know what to do with this information when we don't have all the complete data. Thank you for allowing me to chime in really quick.
Thank you so much, Dr. Wang. And sorry I missed that you popped in there. So thank you. Thank you, Mattie. And so Mattie, the next question for you, I'll go ahead and repeat it. According to the Human Rights Campaign, only 42% of LGBTQIA plus adults say they're highly likely to get the vaccine. A number that's even less, 29% among Black LGBTQIA plus adults. Why do you think that is?
Well, I think it's important to note that the number is actually close to half for trans BIPOC adults. It's 46%, and then lower for BIPOC LGBTQ folks. But that being said, I also think that we are living in a time of false information and also the politicalization of healthcare information. And that is in turn used to deter and scare certain populations away from vaccines. Many times so folks can say, haha, this isn't helping anyone. But that being said, worries about the efficacy of vaccines, side effects, FDA approval, et cetera, are all things that add to those numbers. But I also want to mention that I want to stay away from the narrative that LGBTQ folks, specifically Black LGBTQ folks, are hesitant about this vaccine because of the United States history of non-consensual medical testing. Because while I think that is a worry for folks, I think the much bigger issue is structural and institutional racism, right? And we know that these things are present in our medical system. We know that they were present in testing and who was getting access to testing and who was being treated for COVID in the hospital versus sent home to die despite worsening symptoms, or ignored in the hospital and left in COVID wings to die. I know one thing that I want to bring up, I read a story about an elder BIPOC vaccination site in a Black and brown neighborhood in New York, and they found that folks in the neighborhood, despite having all of these vaccination events, were still under-vaccinated, specifically because white folks from outside the neighborhood were coming in and taking up all the vaccine appointments. And so the folks in who were giving the vaccines were not properly checking where people lived or checking zip codes. And so that was a big issue, in addition to there having been, in that particular situation, no support for elder BIPOC folks to sign up online. So it's things like that that contribute also to low vaccine rates. And in Seattle, we have groups like ARTH, like Utopia, doing very focused vaccine clinics to the LGBTQ population and the LGBTQ elder population as well, and the non-LGBTQ elder population. And we even have groups like Trans Women of Color Solidarity Network and Queer the Land and Black Trans Task Force and Alphabet Alliance of Color. Forgive me if I'm missing anyone, doing very focused vaccine clinics at Taking Black Pride, which is a Black and brown pride event. So we do have Black and brown, cis and LGBTQ folks engaged in focused outreach to their own communities. But I think that if we want to be more equitable in how we address disparities in COVID vaccine rates and even infection rates, then we have to not assume that racism, transphobia, homophobia, and all of the intersectional identities that our communities hold are not also huge factors, right? And why those communities are underserved and less visible in COVID-19 studies and have higher infection rates and lower vaccine rates.
Mattie, thank you. My next question is for Mattie and Dr. Wang. With more vaccination sites now open, what are the barriers that continue for vaccinating those in the LGBTQIA plus community?
Mattie, do you want to go first, or do you want me to start?
Sure. No, I can go first. Let me see. I think some of the barriers present that I've seen are, lack of transportation, lack of adequately resourced focused outreach, right? Because as I mentioned before, there are groups out here doing the work, but we know from various studies that LGBTQ organizations and collectives are some of the least funded. And in terms of trans-specific collectives and organizations, make up only 1% or less of funded, funded organizations in the United States. So that's also a huge issue. I think also less opportunities for our communities to ask questions and have some of those fears that they have acknowledged and addressed in a way that feels good and doesn't feel like finger wagging and doesn't feel like a scare tactic. I think that many folks in our community also work service jobs and frontline jobs and are unable to miss work. There are various reasons that that we can mention. A lot of those things tied into structural oppression, right? But at the end of the day, I think that equity, if we're looking at equity in this, right, means that we are changing what we are doing to meet this need in community, and we're asking community what they need, right, and not just making assumptions.
Thanks, Mattie. This is one of the reasons why I'm so grateful I get to work with them, where I work on a daily basis. I don't really know if I have too much to add other than everything Mattie just said when it came to concerns about barriers to obtaining the vaccine. When it really comes down to all the inequities facing people of multiple identities, so not just the healthcare disparities and inequities facing the LGBT plus community, but also those who are Black, who are BIPOC, who are Indigenous, those who have to work multiple jobs and don't have the ability to get to a vaccine site. Some of the things I'm probably going to focus on has more to do with the distrust of the medical system, which has been kind of highlighted in some of the articles you might read out there. Something just to kind of take note of whenever it comes to pandemics, you have marginalized populations who are often the targets of further oppression and discrimination. We've seen it with HIV, certainly with the LGBT plus community. We've seen it with H1N1, with people from Mexico. We've also seen it, same thing with the plague, when they initially thought it primarily came from the Jewish population. And so it's not too surprising about distrust in the medical system, where they might go somewhere where they're just going to be continually to be discounted just based on what Mattie just shared with us, and with the continued invisibility of the LGBTQI plus community, as Mattie just mentioned. LGBT plus community organizations are often the least funded, and when you don't have all the data available, public health departments aren't going to be able to again allocate funds and resources in order to help increase vaccination rates for the LGBT plus community. And I think going on with the distrust, there's a lot of information out there about, the science behind the vaccines and the cost. And a lot of people still feel they have to pay for it when all the vaccinations are offered for free. I'm happy to answer questions about the science behind the vaccines along with the cost and so forth. But I think the biggest barriers really are the issues Mattie brought up.
Mattie and Dr. Wang, thank you. Our next question is for Dr. Wang. What do you say to those who dismiss the importance of getting vaccinated, and what are your organizations doing to get the word out and increase access to it?
So I would start off with, first of all, getting vaccinated definitely provides you protection for yourself. And what we've seen with all three of the vaccines currently available in the US, it can significantly decrease the moderate to severe disease symptoms, along with decreasing hospitalizations, and certainly can help decrease mortality or people who pass away from complications from the virus itself. I think even more importantly, getting the vaccine can help protect others. So, for those of us who are able to get the vaccine, we're able to help protect those who can't get it or those who are too young, although we now have the vaccine who is indicated for people over the age of 12. It's the same when it comes to other vaccines, right? So when we recommend vaccinations for measles, mumps, rubella, whooping cough, and chickenpox, there are some folks who are unable to get it either because of significant allergic reactions or other complications or other immune issues. And so, we can help protect them by getting as many people vaccinated as possible. People have heard this herd immunity rate of 70 to 90%, which includes kids. And because kids make up about 20% of our population, we need to get as many people over the age of 12 vaccinated so we can protect our community. One of the other great benefits of getting vaccinated is the more we protect ourselves, the lower the chance of developing these variants, which may have sort of worse complications and more infectivity. So if we can get more people vaccinated, we can decrease the spread of variants of coronavirus. Going back to protecting others, more data is now coming out showing fully vaccinated folks are less likely to spread the virus to those who can't get the vaccine and help us stop the pandemic, which can hopefully get us back to some sort of normalcy as time continues. And of course, in combination with CDC guidelines to help stop the spread is going to be really great. And for people who are pregnant or able to become pregnant or who are either chest or breastfeeding, the vaccine is also safe for those who are pregnant. We found out those who receive the vaccine in pregnancy, the protective antibodies in the pregnant person's body can also go to the baby, is also given to them through breast or chest milk, which again allows us to protect our kids who are unable to get the vaccine. Just in general, the data is showing really great real world effectiveness, as I mentioned before. And when I'm thinking about what our healthcare institution is doing, so I work at Swedish. And I'm really proud of the work we're doing, where we're setting up mobile vaccine clinics in coordination with community-based organizations such as Utopia, and really being guided by their efforts in order to reach a population who may have more limited access, who are able to get the word out in different languages in order to help set people up for those appointments. Swedish is also working with the city of Seattle to hold community vaccination clinics at Lumen Field Event Center, and a lot of really fantastic community-based organizations, such as the ones Mattie mentioned, federally qualified health centers, and pharmacies are also carrying the vaccine as well. And as a reminder, the vaccine is for free. All community-based organizations, King County Public Health, Virginia Mason, University of Washington, Kaiser Permanente, and have all sorts of information available for patients. Unfortunately, a lot of it is, we have it on the internet, and so people have to have access, but we are trying to do what we can to get COVID vaccine resources and information translated into as many languages as possible, and to make it as accessible for people who have physical and mental diversity as well. So we're doing everything we can to partner with our community-based organizations, and certainly want to be guided by our community leaders to do it in a way which is in partnership with our patients.
And I know, Krystal, you wanted to jump in as well.
Yeah, I would love to. Something else, as the question is, what do you say to those who dismiss the importance of being vaccinated? One of the comments that we received, the very first one, was, are we going to have the Pride Parade this year? So, as Seattle Pride, we put on the Pride Parade. We can't do this. We can't put people in harm's way without, or we can't put on the Pride Parade without making sure that folks are vaccinated. So I think Dr. Wang did a fantastic job sharing with us why it's important to get vaccinated and what it does just for the actual medical good of the community and from a public health standpoint. But also, if we want to see our events go back to normal, we have to make sure that we're taking care of each other We miss being there with you. We miss being in public and celebrating in community. But it's another reason, if you're looking for all the reasons to get vaccinated, like, let's do this so we can go back to what our normal has looked like.
All right. Thank you, Krystal, and thank you, Dr. Wang, for highlighting the importance as well for getting vaccinated. Our next question is for Krystal. Where can people get more information if they have questions about the vaccine or getting vaccinated?
Sure. So the best resource, I feel like, is always where people are highlighting science. So whether you're listening to what the CDC says or locally, Department of Health, that is always going to be the best resource for information. Sometimes we've seen a better shift on Facebook and social media where it talks about COVID-19. You might have seen something where it says, when you click on something, are you sure you want to share this? Do you want to read the article first, which is fantastic. But I always advocate for going straight to the source. So if you go to doh.wa.gov, so the Department of Health website, the very first thing that you get to on that website, there is a vaccine locator, COVID-19 resources. There's information about the vaccine. It talks about, how do I get it? Where can I get it? How do I know that it's safe and effective? I'm looking on my other screen right now to make sure. The vaccination progress and dashboard data, how does it work? What the distribution is like, frequently asked questions. Will I be charged for the vaccine? And as Dr. Wang has mentioned, no. And then life after the vaccine, what does that look like? And what do you use your vaccination card for? So the best place, again, is straight from the source. And Seattle Pride is really proud to partner with the Department of Health on this, to bring you this lunch and learn, but also to continue to provide information to folks on the status of the vaccine, the status of access for our LGBTQIA plus community. And we continue to do that, and we'll be doing that also at Virtual Pride this month.
Hey, may I also chime in with some additional information? Someone in our comments, Wang Remington, did also mention Uber Lyft is also offering free rides to and from the vaccination appointment. And then there is also more information from King County Public Health, where they are also offering in-home vaccination available to people over the age of 12 who have conditions which make it difficult for them to leave the home and who would also have difficulty getting vaccinated outside the home. So if you go to the King County Public Health website, there is information there. You can also call 206-477-3977 to get some more information, and interpretation services are also available. So I just wanted to give some additional information, because I really love what King County Public Health is doing and really trying to put our patient and communities in the center of healthcare provision rather than requiring patients to come to us, because it's not always possible. So thank you for King County Public Health and Uber and Lyft for really supporting our communities and getting them vaccinated.
And do we have any more questions that anyone wants to add, or Dr. Wang, Mattie, Krystal, anything else that you want to add as we near closing out?
I just want to really make sure to thank Mattie and Kevin for your time today and sharing your expertise. The work that you're doing in the community is not going unnoticed, and it's really important to us at Seattle Pride. And also, Tracey, thank you so much for lending your expertise in moderating and speaking with us. The partnership between Seattle Pride and KIRO 7 is really important, and the fact that you're so invested in our community really speaks volumes, and we really appreciate it.
Well, thank you. I always love being a part of these, especially such an important discussion going on right now. So again, I have to say thank you, Krystal, Mattie, and Dr. Wang. Always a pleasure being able to participate with you and have these conversations. So we want to thank everyone who submitted their questions. We really appreciate it. We also want to thank our wonderful panel for the great conversation, as well as to Seattle Pride and the Washington State Department of Health for making today possible. Also, for more conversations about healthcare, please join us on Sunday, June 27th for our virtual Seattle Pride healthcare discussion. Visit seattlepride.org for details. Until then, thank you for joining us and have a great day.